Today we're going to go in depth on how to reduce the risk of positional vertigo or benign paroxysmal positional vertigo. This is a common problem and a frustration for a lot of people. And in fact, it's a problem that could strike you or anyone you love at any time, especially if you're over the age of 35. While the condition is called benign vertigo, this condition can cause everything from being a minor annoyance with the symptoms to completely upending someone's life and changing even the trajectory of their life, no matter what age you are. In older people, positional vertigo is a common cause of falls and decline, so this is a condition is definitely not benign. So today we're going to talk about how to prevent this common problem that's actually relatively unknown. I'll give you the most powerful ways to reduce the risk of BPPV based on the science. Then we will take a deep dive into the evidence so you can see where this information is coming from and how valid it is. If you like content like this, hit subscribe to the channel so you can get more information like this. Positional vertigo or benign paroxysmal positional vertigo is a common problem people face, but may not know much about until they or someone they know suffers from it. It's a condition where calcium carbonate crystals in the inner ear balance system dislodge from where they should be and get into a place where they should not. So to put it simply, the symptoms can range from rotational spinning and dizziness to just dizziness, unsteadiness, lightheadedness, and a whole host of symptoms. This condition can be annoying and interfere with your ability to exercise or work. At worst, can even increase the risk of falls and injury and leave people completely debilitated. So you may wonder then, are there associated factors for this condition and how strong is the evidence for these factors? And in fact, is there evidence on this? And that is what we're going to talk about today to give you actionable things that you can do to potentially reduce the risk of positional vertigo. Be proactive with your doctor about screening for your bone density and treat and reduce the risk of bone density problems as much as you can. Keep your total cholesterol low since this is a risk factor according to the research. And treat balance problems because head injuries and trauma to the head and neck, especially due to falls, also increase the risk of positional vertigo. And so don't blow off the warning signs of balance problems and falls. See a physical therapist if you have a balance problem and make sure that you get this treated early and exercise and walk on a regular basis. If you have migraines, be proactive with your neurologist so that you can stay well medically managed with your migraine condition. Okay, so those are the most actionable things that you can do as someone suffering from positional vertigo, or if you are a healthcare provider and you want to give your patients actionable things that they can do to prevent positional vertigo from happening.